Hello everybody, I'm here with Ruth Kruger, and Ruth has been coming to see Dr. Davis for about 3 weeks now. And what did you originally come in with as far as your symptoms, Ruth?
Actually bad low back pain and a shoulder that's kind of crooked.
Crooked? Sounds good to me.
Yeah.
And Ruth is 74 years young, and she does have developing arthritis and disc problems within the spine. Now most people would assume incorrectly that at the age of 74, chiropractic would not be a route that they could use. Again, because we use a type of care called superior cervical or upper cervical chiropractic care, this gives us the ability to work on people that have spines that are beginning to degenerate. The process that we use is by clearing out the top of the spine, called an atlas correction, and what that does is it allows Ruth's posture and spine to adapt on its own. Thereby, the technique is non-invasive. Would you agree, Ruth?
Oh, absolutely.
Absolutely. You don't need to be disrobed or take any type of medication, no surgery. And in addition, the key is that we usually get a very quick response. Most of all, it's safe. And so as people get a little bit older, you want to use a technique that's safe and effective and can allow them to get back to their normal daily routine. Would you agree, Ruth?
Absolutely.
Absolutely. Fantastic. So in just a moment, we're going to see Ruth get adjusted by the famous Dr. Davis.
Oh yeah, she's terrific. Absolutely.
My better half. Absolutely.
She is good.
The way in which we determine whether or not Ruth needs to be adjusted on her visit, as well as how well she's improving, is through the use of a machine called a paraspinal thermograph. This is Dr. Davis holding the paraspinal thermograph, and essentially this machine is a non-invasive way of determining whether or not nerves are being pinched, number one, and number two, whether or not her body is detecting and correcting at its optimal capacity. This is a non-invasive infrared machine which can be used on women that are pregnant as well as newborns and children. Here Dr. Davis goes, and she's going to do the thermograph evaluation.
Okay, put your head down just a little bit, please. Thank you.
Okay, Ruth, let's see how you look today.
Alrighty.
Now, what we're going to see are different types of colors on Ruth's evaluation. Green means good or go, or essentially that the body is detecting and correcting at 100%. If we look up at the very top, we can see a red line, which means that there's a subluxation or interference in how well Ruth's body is detecting and correcting. You can also see pinches into the lower back. Those three pinches, the yellow and the two oranges, would make Ruth more inclined to have problems like low back pain, pain into the legs, knees, ankles, and feet. It can even affect major organs like the digestive tract or even the female sexual organs. What Dr. Davis is going to do now is give Ruth a superior cervical adjustment with something called the activator. The activator is a non-invasive mechanism used to realign the top of the spine to remove the interference so Ruth can go back and express that youthfulness.
Focus on a positive thought.
As you can see here, Ruth is being adjusted at the atlas. That's an upper cervical adjustment. And now what we're going to do is do a reevaluation at the top of the spine to make sure Ruth is detecting and correcting at 100%. If you could flex down slightly, please, Ruth. Fantastic. Hands flat on your legs. And then what we're going to do is show a comparison. The evaluation on the right is after the adjustment. At this moment, Ruth is detecting, correcting, and healing at 100% compared to her pre-exam. Great job, Ruth.
Thank
Keep
you.
up the good work.